Insect research sometimes involves procedures that might impact welfare, such as tagging, handling, behavioural manipulations, pathogen exposure, dissection, or lethal sampling. Simple refinements can help minimise the harm from these procedures without compromising the scientific objectives. It also has scientific benefits: reduced stress, healthier animals, more consistent data. Every research project is different, and applying refinement is about making thoughtful, proportionate choices for each situation. Refinements to invasive or terminal procedures do not have to be complex. Even small adjustments, like reducing trial repetitions, using a less invasive tagging method, or improving restraint or handling time, can make a significant difference. In this video, we'll cover a few refinements for invasive and terminal procedures, including humane endpoints, release and euthanasia, and anaesthesia. Humane endpoints are pre-planned points where an insect would be removed from a study to limit unnecessary harm. In some studies, these may include failure to feed, loss of mobility, or visible injury. In non-terminal studies, this can help to ensure that all participating animals are healthy enough to continue. In terminal studies, this can help ensure data points are collected efficiently while minimising any unnecessary suffering prior to death. However, not all studies are suitable for these approaches, especially when long-term or delayed effects are central to the research question. In these cases, a clear, well-described research design and justification for lack of endpoint decision is best practice. Sometimes insects may be able to be released back into the wild following a study's completion. Researchers should demonstrate this follows legislation, local regulations, and best practice. In general, insects should be released near the point of capture and in good condition. Social species should be reintroduced with their conspecifics. Euthanasia is often necessary. Methods should aim to be rapid and minimise the likelihood of distress where possible. Feasibility, safety, and the research context should guide decision-making. Preferred options may include rapid mechanical destruction, such as crushing or grinding or shredding, freezing in liquid nitrogen, anaesthetic overdose, or potassium chloride injections. Other common methods require further consideration or justification. Methods such as suffocation, starvation, drowning, or freezing may sometimes be required to answer the research question, or are the only practical method available to researchers in many contexts. Where possible, some veterinarians have recommended pre-exposing insects to cool temperatures or anaesthesia before freezing. However, these refinements may not always be practical or available to insect researchers. In any case, whichever method is selected, justifications should be clearly documented so that they can be included in publication, supporting the wider community and improving methodological reproducibility. Some studies may involve procedures where anaesthesia or analgesia could be considered. However, the evidence base for anaesthetic and analgesic use in insects is limited, and access to most veterinary-grade agents is currently often restricted. General anaesthetic options that have shown promise in some insects include isoflurane or sevoflurane, MS-222, or CO2. CO2 and cold are commonly used. Their impact depends on species, exposure time, and use context. In many labs, they are the only practical or safe option available. In the UK, isoflurane and sevoflurane and MS-222 require veterinary oversight and are currently unlikely to be accessible for most entomologists. In remote field settings, access to veterinary-grade anaesthetics may not be feasible, or it may endanger the health of researchers. Risk assessments and local ethics processes should guide decisions. Guidance on what options are available can be sought from in-house veterinarians. For veterinarians, guidance can be sought through the Veterinary Invertebrate Society and the latest version of the Anaesthesia and Analgesia in Laboratory Animals textbook. Researchers may need to discuss options with health and safety teams, the institution's veterinarian, or the ethics panel members where needed. decisions should balance animal welfare, researcher safety, and the practicality of implementation. Applying refinement to invasive and terminal procedures is about asking good questions. This can help minimize unnecessary harms and confounding factors that can be controlled. Questions to guide reflection include: could this procedure be modified to reduce potential harm? Can anaesthesia or analgesia be used? Have clear, observable, humane endpoints been defined where feasible? Is the euthanasia method appropriate, humane, and user-safe, given the research context? Applying refinement is not about achieving perfection or avoiding all harms. It's about making thoughtful, practical choices that reflect the values of careful science, respect, and commitment to best practice. Thank you for engaging with this video series. For further support, resources, or case studies, please visit the Insect Welfare Research Society or Royal Entomological Society websites. The societies also host a collaborative CPD course that covers many of these topics.